if you are an overprotective mother or father, don't be alarmed by the initial stuff I'm going to tell you. But heel pain in children is something very unique, and it is nothing like heel pain in adults. Something kind of crazy is going on. So, this is what's happening in your kid's heel between about the ages of 9 and 15. A normal heel is not supposed to have this gigantic open area in between the heel, but that's what's happening in your kid if they have heel pain at that age. So what's going on is this is called a calcaneal apophysis. The calcaneus, which is the heel bone right here, has not fully fused yet until you finish hitting puberty, so about ages between 13 to 15, depending on if you're a boy or a girl. So what's happening is, as the Achilles is pulling and the plantar fascia is pulling, you have this large clear space, but it's not a break, it's still cartilage that is ossifying. But this can still cause very severe pain in your child. So as the Achilles tendon starts pulling, it jerks on the back of that heel and the plantar fascia at the bottom, right here. Every time you push off with your foot, jerks on it the other way. So it's definitely irritating it. But don't worry, your kid's not going to shatter their heel and become an amputee and be in severe pain, because I'm going to tell you how to take care of it. This type of thing usually happens at the beginning of sports season. So when soccer season starts, and it happens almost always in 9 to 12-year-old girls, because they hit puberty a little bit earlier than boys, and that's when the bones start fusing, and about ages 11 to 14 in boys. Now there is some variance, but if you have a teenager that's 16, 17, if they have this kind of heel pain, this isn't what I'm talking about. What they're suffering from is more plantar fasciitis pain, and that could be treated as an adult condition. So it happens in boys 11 to 14 and girls 9 to 12, because we all know girls are more mature than boys. And this can last from 2 to 8 weeks, and that's even with good treatment. So I'm going to get into exactly how to treat this. What you want to do is, stretching is a good foundation. What's causing it is tight Achilles muscles, tight calcaneus, and overuse of the heel. So what you want to do initially, you want to get the inflammation to go down. You could use some heat as directed. You could use some ice packs. You could use some anti-inflammatories. But with kids, don't use any anti-inflammatories according to me. Go see your podiatrist and get a prescription and get someone who can actually check up on your child, check the age, see what's safe for them. But some type of pain medication to decrease the pain. But ice and heat is a great start, and that could be all that's enough. So what's happening is the Achilles is tight and the plantar fascia is tight, and it's yanking on this thing and causing it to swell and cause pain right in the middle. So you want to stretch your calves, stretch your plantar fascia across the bottom, and stretch your hamstrings. Those three muscles will take a lot of stress off your heel. The general rule is all three of these muscles 2 to 3 times a day for about 10 to 15 to even 30 seconds. And that's it. After about 2 to 8 weeks, you should start feeling a lot better. But if your kid was having these problems, they probably are off a little bit with their foot biomechanics. They may have what's known as biomechanical abnormalities. So make sure you get them a good pair of shoes. Look into getting over-the-counter inserts or ones from your podiatrist. And get possibly a night splint that stretches out their calf and their foot as their tissues are still soft as kids. You don't want to end up like this when you're an adult needing heel pain injections like some adults do for their plantar fasciitis pain. And as you start getting older, I'm not going to recommend orthotics because it's a waste of money probably for a growing child. You could get them. They definitely help. But the child outgrows them in a year or two. So it's up to you. If your insurance covers it, it's great for your kid. But it's not something that's going to be drastically more improved or essential than over-the-counter orthotics. And then lastly, you should, if you're worried, if the pain doesn't go away after 2 to 8 weeks, go see your podiatrist. You should get x-rays because there is something that could be a little bit more dangerous. What's known, you could have a bone cyst, an aneurysmal bone cyst, and it could be other things, maybe early onset inflammatory arthritic conditions, that kind of thing, although that's unlikely. But if it's not directly at the back of the heel, like I showed you, and it hurts inside the heel, or it's not going away after 2 to 8 weeks, just go get an x-ray. Go be safe. Your child has a long life ahead of them. What's, an hour out of your day? Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.